The biopharmaceutical drug market is expanding at an unprecedented pace, fueled by groundbreaking innovations and the rapid adoption of new therapies. But with progress comes complexity, soaring costs, evolving regulations, and persistent access challenges. How is the industry adapting to navigate these hurdles? And what strategies are unlocking new opportunities for patients, providers, and innovators alike? I'm Michael Sarshad, your host, along with Sarah Rubin, for this special series of the Accessia Health podcast in collaboration with Accessia and the Specialty Pharmacy Summit. In conversation with key thought leaders and industry experts, we'll explore the dynamic forces shaping the market today. Tune in as we discover key strategies, industry trends, and collaborative innovations driving the future of market access and specialty pharmacy. Welcome to the Accessia Health podcast, Navigating Modern Market Access.
My name is Michael Sarshad at Accessia Health, and I'm your host for this episode of Accessia Health podcast special series, Navigating Modern Market Access. We're recording from the floor of Accessia's AXS 25 Summit, and today I'm joined by Tiara Green, President of Accessia Health. Welcome to the Accessia Health podcast.
Thank you so much. I'm so glad to be here.
You and I had a chance to speak a little bit beforehand and connect, and I know there's a lot going on in Accessia, but Accessia Health is doing a lot of great things, so I want to learn a little bit more about that. Tell me a little bit about some of the trends that we're seeing with patient support today. What are some of the unmet needs? How are they changing? How is Accessia Health supporting that as well?
Accessia Health is a national nonprofit organization that assists individuals in affording their health care. And when we say affording their health care, we're thinking about individuals who have rare and chronic conditions. And one of the trends that we're seeing in this industry of patient assistance that began with copays for medications is that it's expanding to be more holistic. So it's addressing some of those social determinants of health needs that go into transportation. How are individuals able to get to their doctor's appointments, and even wraparound services for mental health? When you are dealing with some of those rare and chronic conditions, it weighs heavily on you. So you start to see the need for some mental health services, and we're happy to be able to provide some of those services so that individuals are not necessarily focusing on how are they going to pay for some of their household expenses, but they can focus on their healthcare journey. And if you look at the patient assistance arena, a lot of programs have shifted to offer transportation and mental health services.
There's a huge burden, both with chronic and rare diseases, because there's unmet need, there's education component, there's a changing the way you live oftentimes.
Absolutely.
It's got an emotional component in it as well. And we're also seeing HCP's burden with explaining the process and helping the patient, bring them along the journey of that path as well. What are some of the things you're seeing in that arena?
It's really tailored communication. When we think about healthcare providers and working with them to make sure that, when I say them, I mean the people they're serving, how are they going to make sure that they are able to adhere to their treatment plan is personalized? They're able to dig in to say, what is it that you need, and then give them the resources or connect them with community-based organizations who can then help them meet their healthcare need. I love that model because it's more of, this is what I need, and what I need may be different from what you need. It allows them to say, hey, we understand that you have an unmet need here, and maybe it's just food. Maybe I have diabetes, but I'm not able to really control my A1C or glucose levels because I don't have access to the right foods. So they may connect them with those resources.
So technology is a hot topic. Just on a panel a little while ago, and obviously AI is huge. You can't walk without getting hit by the AI stick around here, but tell us a little bit about technology. How are you seeing technology play a role in advancing care, simplifying the process of patient support services, all the above?
From a patient support perspective, I look at technology and the application process and how many organizations are simplifying to make it more automated, and the eligibility process so that it's more real time and able to get the individual to the copay assistance or that travel assistance that they may need within a day or so. So leveraging all of the technology that is out there to determine their eligibility, number one, but you also see an increase in health monitors, being able to use telehealth from home, especially in those areas that are more rural, and their specialty physician may be very far away from their home, 1 to 2 hours. If I can have a telehealth visit, it makes things a whole lot easier. So I think we're going to continue to see an evolution and an increase in the number of practices that offer telehealth, especially since COVID. Here we are 5 years later, and we're still talking about it. How can we continue to expand? And when you talk about AI, chatbots, things like that are able to answer questions real time based on some algorithm behind the scenes, so that individuals are not necessarily waiting on the phones for patient support. We better get ready.
Yeah. We might turn into chatbots ourselves, right?
That's right. That's right.
To talk a little bit more about telehealth. So telehealth, obviously, as you mentioned, became much larger as a result of COVID and the necessity that was there. But how can we bring providers along the journey to make them smarter and more effective when it comes to telehealth, whether it be just individual telehealth providers or the providers themselves who are just doing remote virtual sessions?
I think it's education, and the providers have to be willing to listen and receive that feedback. If you aren't getting feedback from the very population that you're serving on what's going to work for them, then you're missing an opportunity there. So I think we have to bring those healthcare providers on to say, hey, listen, if you have a low adherence rate with your patient population, if you have a high number of no-shows, are you looking to see what other opportunities are out there from a telehealth perspective? We can tackle some of these things and hopefully get some conditions under control.
How do you help them with something like that? Let's say they had a large number of no-shows or whatever that might be. How do you educate them or support them to improve that process?
Communication. That's really it. It's having that conversation with them and bringing that patient voice to the surface to say, what is it that you can do? And we, as patient support groups, can say, hey, these are all the opportunities, and we can support the patients on our end on how do I effectively communicate with my physician in order to advocate for myself or talk to them about other options that may be available.
By the way, how do patients find you? Like, how do they know about you? How do they reach out?
It's a lot of word of mouth,
yeah,
first. But secondly, we reach out to patient advocacy organizations. If you think about some of these rare and chronic conditions, there's frequently a organization specifically for that. I'll just use the Fabry Association. They are the ones that are putting out information for individuals with Fabry, and they'll say, hey, on their website, these are all of the organizations that has financial assistance. And they share that information and they come to us. They apply for assistance on our website, or they're calling to speak with one of our representatives.
Okay, the partnership model is working.
That's right. That's the way it's supposed to be.
Okay, so obviously we're at Accessia. I want to know, what are some interesting things you're hearing or learning at the conference that's really getting you excited for the future?
Partnerships, exactly what you just said. And I said that last year. Last year was my first year coming, and I heard a lot about the value of partnerships, whether it's specialty pharmacies and community-based organizations or physicians, and this communication. Same thing this year. And this year, people are actually like, hey, how are you making this work? How can we have this exchange of ideas? Because at the end of the day, we're all hoping for the same thing, improved outcomes for the people that we serve. So I'm excited to continue to talk to organizations about how we can potentially partner to move the needle.
Okay, last question. If you had a wish list and you got to ask pharma manufacturers for one thing they could really change to make the patient support service experience better, more comprehensive, more effective, what would it be?
I think even though we're not supposed to say equity, it's making sure that we have a diverse group of individuals that are participating early on and in programs and clinical trials. And then the clear communication and understanding that health literacy goes on both sides. It's the individual, but it's also the organization and how we're communicating with individuals. So it has to come in from both aspects. And we need to make sure that those that are participating in these trials look different. They are different. Their genetics are different. How can we ensure all people are involved?
Amazing. Love that. Thank you very much, Tiara.
Thank you.
That's all for today's episode of the Syneos Health Podcast, Navigating Modern Market Access. I'm your host, Michael Sarshad. If you have any other topical issues you'd like to hear on this podcast, please send us a message at podcast@syneoshealth.com For access to more future-focused, actionable life science insights, please visit the Syneos Health Insights Hub at insightshub.health.